Hello, my name is Carolyn Clausen, and I am someone that believes in social justice, in those of us that can doing what we can to make the world a better place for everybody. And I would like to talk with you for a few minutes today about how important it is for those of us who can to get vaccinated and those of us who are able to exceed the provincial restrictions as an act of social justice. Martin Luther King says the ultimate measure of a person is not where he or she stands in moments of comfort and convenience, but where he or she stands in times of challenge and controversy. This is a really hard time. We are 14 months into a pandemic. All of us are eager for spring, the chance to get out more, the chance to enjoy the sunshine and to be with friends and family and to do so many of those normal things that we haven't been doing for months. But here's the thing. A study was done, and we know that the provincial data in Manitoba shows that racialized people, especially those living in lower income neighborhoods and overcrowded homes, are bearing the brunt of the problems of COVID-19. We know that Black, Indigenous, and people of color communities are disproportionately affected, just as they are in other jurisdictions and other parts of the country and the world. It's bad. We know that India is having a second wave that is wreaking horrible tragedies as they are running out of oxygen. And we know that in places like Ontario, they are well into the third wave and their systems are overwhelmed. We are on the cusp of a third wave here in Manitoba, and we have the ability to figure out how bad that third wave is going to get by our own actions right now. And so here's the thing. Vaccines are here and we can book them and we can get them. I've got my appointment booked, but I have not yet gotten it. And the pace of the vaccine delivery is competing with the pace of the new variants as they are more infectious and more able to get many more people sick. That competition is tight. And so those of us that can get the vaccine need to get the vaccine. 95% of physicians that are able to get the vaccine, those people that are experts in medicine that know the risks and the benefits, when they can get it, 95% of physicians go for it. For me, that's really important to say the vaccine is safe and the advantages very much outweigh the disadvantages. And I would encourage you to get it not only because it's good for you, but because it's good for people around you and good for the entire province. People that you don't even know will benefit as we all work towards herd immunity. We can save those that aren't able to get the vaccine for whatever reason. We can help those people by getting the vaccine ourselves. When the entire community is safer, we make it safer for everybody. Pope Francis says to live charitably means not looking out for our own interests, but carrying the burdens of the weakest and poorest among us. The restrictions are high, but they can get higher if our numbers get out of control. And so what I'm encouraging is that those of us that can, we live above what is required of us. Dr. Jazz Atwell, who's the Deputy Chief Provincial Public Health Officer here in Manitoba, is asking us to exceed the restrictions as we are able. And there are some for whom they are not able to exceed those restrictions. They need to get out and work in order to put food on the table. They have no choice but to get out there and to teach our classrooms or to be nurses on the front line or to be on the front line at the grocery stores and in taxi cabs. Those of us that are able to be able to stay at home, to avoid going to the malls, to avoid going to a place of worship, by worshiping at home, we can exceed those restrictions and protect those who are not able to get to exceed them because they need to go out and serve the community. There are those that have mental health challenges either because of the pandemic or pre-existing prior to the pandemic, and those people need to get out. They need to go to mosque, synagogue, or church. And for those people, I want the restrictions to remain at this level so that you can get out and maintain your mental health. This message is not for you. It's for the rest of us who can maintain our mental health and still not go to those places, still be able to stay home as much as possible, to visit in the backyard with just a very few people, to find ways of not spreading the virus as best as we can. These are really hard times, but as an act of social justice, if you are able to, can you make sure that you get vaccine and exceed the expectations? Because when we help those who are less advantaged by doing those things, we are making a difference in this world, and I invite you to join me in that effort. Thank you.